Thank you so much for having me. I'm really excited to be here, and I wish we could be together. So I'm going to share today about the motivational science of how to hack human health behavior. So motivational psychology does have some very good tools for helping people to engage with behavior change and stick with it for the long term. As a product designer, your challenge is that your success may depend on your ability to change people's behavior. And some health outcomes require a limited number of episodic behaviors. Others require people to sustain changed behavior over time, maybe even forever. And that's what's really hard. It's essential for a health designer to know how to hack motivation and tap into what really matters to people so that they can affect those long-term sustained behavior changes that are really necessary to make a health behavior product effective. When I design an intervention for health behavior change, I start by defining the outcomes that I hope to achieve. What you see here is an example of a tool that I call the outcomes logic map. And I actually start by defining the long-term outcomes and then working backwards and identifying the behaviors that people need to do in order for those outcomes to come true. And then even before that, how do they need to interact with my intervention in order for their behaviors to change? And of course, we want to measure baseline, today, current state, so that we can understand what change looks like. If you think about what happens during a health behavior change intervention using this framework, you can see that there are at least two places where motivation is needed from your users. The first is for them to interact with your intervention in the first place. They need to have a reason to do that. And then the second is for them to actually change their behaviors as a result of interacting with that motivation, with that intervention. Both of those pieces require motivation. A simple definition of motivation that I like, and I hope this works in French, is that motivation is desire with velocity. The reason I like this definition is because motivation, like velocity, has a direction. It takes a target. So when we talk about motivation, there is a behavior attached to it when we think about it from a psychological perspective. The theory that I use most often to think about motivation is called self-determination theory. It has about 40 years worth of research history, very robust findings, and it has a lot of research where it's been applied to the design of interventions. So I like that it has such a strong evidence base. And one of its key tenets is that the source of motivation matters a lot. So it's not just, do you have a lot of motivation or a little motivation? It's also what type of motivation do you have? And as designers, we want to really understand what matters to people, but then also design experiences that help tap in to the more powerful forms of motivation. So what you see on the screen is what's called the motivational quality continuum. And I will build it out here. On the left, we have what we call controlled forms of motivation. These are forms of motivation that do not come from inside of a person. They come externally. Of course, external as a label describes that pretty perfectly. Amotivated are people who aren't motivated at all. And typically as a designer, I don't include them in my user population. Maybe one day, hopefully one day, they will decide that they're ready to make a change. But it's very, very difficult to get people who are not interested to do something. So we set them aside for now, and instead we focus on people who have some source of motivation. And that starts with external. That's when somebody has an external reason, an extrinsic reason for doing something, which may be a reward or a punishment or an expectation set by somebody else. Introjected is the next form of motivational quality, and that's when someone has internalized that external force of motivation. When I'm talking to somebody, when I'm doing research for my product, and I hear them say, oh, I know I should eat this meal, or I know I should take that medication. That word should is an indicator to me that somebody has delivered to them an expectation that they do this behavior. Those two forms of motivation are known as controlled because they come from outside. The more powerful forms of motivation, the ones that we would really like to connect with our users, are called autonomous forms of motivation. And they're much more powerful over time because they connect to things that are already personally meaningful to people. So we don't have to do the work of creating reasons for change. What we're trying to do is connect to existing reasons. So we have identified motivation. That's when a person has goals or values that are related to a behavior. And when I say goals, I don't mean the goals within the intervention. I don't mean lose 10 pounds or walk 10,000 steps. I mean, be a good parent to my children. Those sorts of goals that are very personal. Integrated motivation is when you have an identity that says you are the type of person who does this thing, and it makes it easier to do a behavior. And then intrinsic, you may be familiar with, it's when a behavior is pleasurable, enjoyable on its own, and people do it for its own sake. And as you probably know from your experience in health behavior change, we're not usually talking about behaviors that feel good, at least in the beginning. If you've ever started an exercise program, you know it can be physically painful and mentally difficult. So that's a goal, that we create experiences that are intrinsically motivating, but typically we're not dealing with that. The way that we design experiences that tap into these sorts of motivation is by supporting what are known as basic psychological needs. And the research in self-determination theory shows that there are three. So the first is autonomy, where people can make their own meaningful choices. And I'll share examples of how all of these can be brought to life within a digital health intervention. But I do want to say that the word meaningful is very important. This is not choosing the color of your background screen. The second basic psychological need is competence, and that's people's sense of learning, growing, and succeeding. We like to think that the behaviors that we do have an effect in the world, and we're always looking for evidence of that. And then lastly is relatedness. We are a very social species, and we're always looking for examples of how we're connected to others, whether it's individual other people or more of a community. So as designers, if we can reflect to our users that there is a community around them, that they are not alone, that's something that's very motivating and helps them connect with those autonomous forms of motivation, which then in turn leads to them sticking with that behavior over time. So if you want to translate this to hacks, specific things that you can do within your design, here are some high-level recommendations, and I will go through and show examples of all of these. But for autonomy, help people feel like they have control. Show them where they can make choices. And even within the product, if you can design a choice architecture that gives people meaningful choices, that's something that will be helpful. For competence, a lot of behavior change is very difficult. We ask people to do big things. So if you can break that down into smaller tasks, if you can make it easier by providing education and support, that supports competence. Encouraging progress. So thinking about a phrase that I hear often in English is progress, not perfection. That mentality, that attitude is really important for competence. And then conveying a sense of growth and accomplishment. Let people know when they've done good. Finally, for relatedness, connect people to others. If there's an opportunity to make a health intervention actually social, that may be a thing to explore. And then, of course, you don't need to have other people involved in the intervention, but can you show how others are sharing the experience? So again, I will show examples of all of these, but I wanted to provide a tip sheet, a high-level list of what these hacks might look like. So let's start with autonomy. This is the first motivation hack. It's finding opportunities to help people feel that they have control and they can make meaningful choices. And what does this look like? Well, the first way it looks is to minimize external pressure to use a health behavior change intervention or to make a change. And we have probably all had experiences where somebody else has had an expectation that we do something. As designers, we want to try to avoid that as much as possible so that people come to an experience with their own choice. I don't know how much this happens internationally, but in the United States, we often structure health behavior change programs so that there's a financial reward for participating. And from a motivational science perspective, that is not a good decision. People get very fixated on that reward, and they may not take the time to form a personally meaningful reason to participate. So if you are in a situation where there is a financial reward, what I would caution is to calibrate how much that reward is. The bigger the reward, the more people fixate on it. So if there must be a reward for some reason, make it small. Make it as much of a token reward as you can. The second tip here is to tie rewards to meaningful behaviors. So make sure that the things that you're rewarding are actually the things that will produce results. An example from my work, I worked on programs where people completed a questionnaire, and then the information from that questionnaire was used to deliver coaching, and then the person needed to follow the coaching. Some people provided a reward for the questionnaire. Now, that's an important thing. We need that information, but really what matters is that people use the coaching plan. So my recommendation would be, let's reward the coaching plan. And then finally here, consider non-financial rewards if you can. So if you have an exercise program, instead of giving a person money for participating, can you give them a new pair of athletic shoes or a membership to a fitness facility? Those sorts of rewards will encourage the behavior to continue, perhaps more than money will. Explain rules and why they exist. So I've mentioned giving people meaningful choice, but the fact is that with health behavior change, sometimes there isn't a choice. Some goals have a clinical protocol that people need to follow in order to achieve them. And if that's the case, it's important to let people know. That way they understand that they are making a decision to engage in an experience where they will not have choices every step of the way. But the reason for that is because it will help them get to the goal that they value. So providing those rationales is a really important thing to do early on in a user experience, during onboarding, or even before, when you're trying to convince somebody that they want to join a program, so that they've truly opted into what the experience will be. Another way to help people make meaningful choices is to allow them to model what different versions of the choice might look like. These are two different tools. One is called the snowball debt reduction tool. So it's, if you have multiple debts, it allows you to look at different scenarios for how to put your money into them so that they get paid off. And then the other one is a cardiovascular risk tool that lets you see how different behavior changes might affect your risk level. Both of these tools do the same thing at its heart, which is they allow you to say, what if? And then based on what you learn, you can make an informed decision. This sort of scenario can be very helpful to people when they're balancing different health decisions and they're not sure which one to take. Another tool that is in use now is something called the patient shared decision-making tools, or SDM, you might see. And they look a little bit like what you see here on the right side of the screen. It's typically a very patient-friendly questionnaire that looks not just at the clinical aspects of a decision for a condition, but the lifestyle aspects of it. So how important is it to have flexibility in your schedule? Some treatments require people to be at a hospital or at a health center on a very regular schedule. And if somebody works a job where they don't have that flexibility, that could be a bad treatment for them. But typically, if you're a physician and you're making the decision, you're just looking at the science and not necessarily at the patient's lifestyle. So this is a tool that allows doctors and patients to have a conversation about what matters to the patient. And in a review of these tools, what caught my eye as a behavior scientist is that people who use these tools make decisions about treatment that are consistent with their values. And we know from motivation that that means they're more likely to stick with that treatment and to do all of the other behaviors that are necessary to make it effective. And in fact, I just did a literature review. These are just 6 headlines, but these are all articles published in the last 12 months in high quality health journals that show positive effects of using these shared decision-making aids in all different areas of health. So this works to give patients a voice to allow them to make meaningful choices about their health. And it's something that we can adopt in our digital development process. Letting people pick their goals. So I mentioned that when we talk about goals, there's it's not just I want to lose 10 pounds, it's I want to be a good parent, or I want to have energy during the day so I can be effective at my work. If you can let people put the language around their goals that reflects what matters to them, it helps them create that personal connection to the intervention so that what's driving them is their goal and not yours. These are 3 examples of digital health programs that do a nice job with this. So Pacifica is one for mindfulness and mental well-being. Noom is for weight management. And Kumanu is actually a companion app for other programs. So it doesn't have a specific health behavior, but you can use it alongside another app, and it helps you think about your values as you make day-to-day decisions. Value consistent framing is another really important tool for supporting autonomy. So we know everybody has values, and there's actually a core set of universal human values. If we can get people to think about what matters to them and then talk about health behaviors in a way that aligns with that, we can get them more interested in the behavior. I've mentioned a few times that goal or that value of being a good parent. And I've successfully seen conversations with clinicians and people who are cigarette smokers where that good parent value is used to talk about quitting smoking. Because if somebody is a good parent, of course you can still be a good parent and smoke. But you can say to somebody in a gentle, therapeutic way, you know, you want to be there for your children long into the future. You want to have the lung capacity to be able to run and play. Talk to me about how smoking fits in with that. And that starts to create some cognitive dissonance for people where they may choose to change their behavior or not. Encouraging people to do the analysis themselves is another tool here. So this is basically getting people to do small experiments or research into their own motivations for doing things. We have reasons for almost everything we do. And if you ask people to reflect on that and you give them some structure to do that, they may uncover the information they need to start to make a change. So what you see here is an exercise from the book Indistractable by Nir Eyal, which is about helping people to use technology more purposefully. So a lot of us are glued to our cell phones and prefer not to be. And this book gives you a toolkit to not do that. And it has a lot of great examples in some of the workbook materials of how to help people do this analysis themselves so that they can make a meaningful choice. Translating values to actions. So it's not just framing a behavior as actions, but it's helping make sense of a confusing set of options. This is from an app called Stash, which helps people invest their money in the stock market. That's a very confusing thing for a lot of people, especially if they're new to doing it. And so this actually lets people talk about what they value. Here we see environment or social responsibility. And then it says, okay, if you value the environment, these are some of the stocks that you want to invest in so that your money supports your values. This is a great example of taking something that's meaningful to somebody and helping them apply it to their behaviors. It's not health, but it's a good analog. You can also design the actual physical layout of an experience to help people guide them to the right choice. So they are still freely making this choice. This is really a nudge. But you're giving them some information in the visual design that helps make that choice easier and helps show them some of the factors that they might find meaningful. So this is from Evernote. We see this in the United States often with health insurance plans. I know that the United States has a very different healthcare system from most of the world, so I decided to show something a little outside of healthcare. I think it might oddly be more relatable in this case, but when you have multiple options and those options have a lot of variables, there's a way to display the alternatives so that people can be guided to a good choice. And then, of course, make the good choice the enjoyable choice. This is a famous example from Scandinavia. A design agency put a piano on the staircase in a subway station. And they found that instead of people taking the escalator, they chose to take the stairs because it was fun. So how can we design health behavior change to be fun so that people meaningfully choose to do it? The next set of motivation hacks are related to competence. So this is that sense of learning and growing. And what we can do here is design mechanisms that make hard tasks easy, encourage user progress, and convey a sense of growth and accomplishment. These are all some classic findings at this point about enhancing user ability. So organ donation in the United States, 401k is a type of account we use to prepare for retirement. Both of those, if you switch enrollment from an opt-in to an opt-out, if you make it harder to not participate, you find that more people will do it. And really, I think more than anything, that's about making it easy. And then the other example here is a mammogram. And there's been some research that shows that if you provide somebody with a reminder phone call about their mammogram, and at the end of the call, you automatically connect them to their doctor's office, they are much more likely to make that appointment and then to actually follow through and have the appointment. And that's an example of removing some mundane tasks from the workflow. So the user does not have to remember to look up the doctor's phone number, to pick up the phone and make a second phone call, and so on. We've made this easy. Measurement is really important here, and I showed that outcomes logic map that I use in my design. Measuring a baseline is really important, not just for us as designers to know what sorts of change we're affecting, but also for users, for the people who are trying to change their own behavior and achieve their own goals, to understand where they're starting. And so this is just some information from various research studies that show that when you measure, aside from any intervention, aside from any direction to change, people do start to change, because once you see what the data is, it gives you a baseline to work from. And sometimes it surprises people too. They don't realize what the baseline looks like until they measure it. But it's a really important thing to do, not just for the design team, but for the user. And then once you have that information, how do you make sense of it? One way is to compare people to reference groups. So what you see here on the screen are examples from an app called Drink Less. It's for university students in the UK. The data that the scientists who developed this collected suggested that they were binge drinking a lot of alcohol. And it was because they believed that that was the cool thing to do. Everybody is doing it. And in fact, people were overestimating how much their peers were binge drinking. So this app, all it really does is it gathers some information about who the person using it is, and then it shows them how much their peers are actually drinking to give them a more realistic baseline. They can take their data then and say, oh, I don't need to go out and drink more because I'm totally normal. I'm in the normal range. Feedback is also a really important way to help people make sense of their performance. And I'll just build this here. This is an example from a video game called Rock Band, and it offers feedback at multiple levels. This is really important for health, but nobody does it better than video games. So at the bottom of the screen, you can see you're playing an instrument in time with the images on the screen. And the goal is to be exactly on time. And if you're not, you get an immediate visual feedback at the bottom of the screen. And that helps you calibrate your performance for the next keystroke. So it's in the moment, immediate, very performance focused. In the top left of the screen, you see your ongoing feedback. So this is where you see your total points. It's where you see your streaks. It's where you see your power-ups. And it's accumulation of your performance over time. This is incredibly important in health behavior change because oftentimes people have small failures along the way, and we need an opportunity to reflect back to them that they have done well. So if you think about weight loss, people will plateau, but using a tool like this lets us help them reflect back that they have still made a lot of progress so that they can remain motivated. And speaking of weighing yourself, one thing that is very important for successful weight loss and maintenance is weighing yourself every day. But people quit because they get frustrated by small, predictable weight gains. So this is a tool, the Shape'a, that actually uses it does not tell you how much you weigh, but it uses a statistical analysis to just tell you, are you the same? Do you weigh more? Do you weigh less? So it basically tells you, is this a meaningful change in your weight? And what they found in a trial that they did is that people who used this scale used it longer and lost more weight than people who used a traditional scale. So making that feedback meaningful is a way that you can also make it more engaging. And then I keep saying make hard goals easier. One way to do that is by creating sub-goals and structuring them in a way so they build on one another. So what you see here is a program called Duolingo. It's a free language learning program online, and it breaks language lessons into very logical small blocks that are achievable. And as you go through them, you suddenly find yourself better and better at the new language. Great example of what we want to do in health behavior change as well. And then the last part is the motivation hack number 3, relatedness, showing people how they are part of something bigger than themselves. So I mentioned we're very social creatures. This is examples of a video game from a research program on ostracism. And it's if you are playing this game, you're the tiny little hand in the bottom of each of these panels, and you're playing ball with the other 2 characters. And in the game, eventually the other 2 characters start to ignore you. What the research has found is that no matter what you tell the person playing the game, if you say, hey, this is a computer, it's totally pre-programmed and it has nothing to do with you, they still feel incredibly sad when they're left out because we are so sensitive to belonging. People who are designing digital health behavior programs often think that social media would be a great tool to support this basic psychological need. And it can be, but I just want to say it's only one tool. There's lots of other options. And so don't limit yourself to social media as the way to accomplish this. If you are using social media, though, authenticity is really important. The way that pharmaceutical and medical companies are regulated in the United States makes it very risky for them to talk about their products or specifics of health conditions on social media. So these are some examples of what some pharmaceutical companies in the US have done to connect with patients or users online without meeting those risks. And the one example I'll point out, Johnson & Johnson, of course, has their baby products. And so across all of their businesses, they talk a lot about babies. It's very authentic to their brand identity, but also very low risk. Being relatable can also include humor. So these are two chatbots that are for health. ViviBot is for teenagers who've survived cancer, and Wobot is for people who have mood issues. And both of them have really authentic language, lots of light humor, and they're very easy to use and enjoyable, and they help people feel like they're actually talking to something real. Leveraging community for behavior change. These are some social platforms. myHealth Teams is condition specific. And what I wanted to point out here is that people who participate in them, this is an example with multiple sclerosis, but people who participate in these sorts of platforms may be more likely to engage in things like clinical trials that can be very important for both science and health outcomes on the individual level. So we can use community to actually support behaviors. And then, of course, everything is better with friends. So in the case of myHealth Teams, you're meeting new people who also share your health condition. But here, this is connecting with folks you already know, the people in your life already. This is from Fabulous, and then Super Better and Fitbit. All three are health behavior change apps, and all three provide a mechanism for you to engage with the people who are already part of your life so that they can support you as you work on your own health behavior change. Normative feedback is a tool that falls in here as well. It also supports competence, but telling people what others are doing, how do you fit into the bigger picture? So with quitting smoking, a really interesting thing is that most people fail when they try that. They fail upwards of 30 times, according to some research. And knowing that could be very reassuring to somebody who just failed. But if you don't communicate that right, they might also hear, it's okay, nobody succeeds. So it's very important if you are using this sort of feedback to test, do different versions, talk to users, and make sure that the way that you frame it actually communicates what you would like to communicate. Personalization is helpful. And the reason why personalization is helpful is because it reflects back something about the person. Being in a relationship means that you are seen and acknowledged. And if personalization sees something unique about you, you can feel that same sense of relationship. And the more personalized, the better. This is from a company I used to work for where we personalized our coaching. This is the coaching plans I mentioned before. And we actually used an algorithm to build these word by word. And you can see in the highlights that we used all kinds of individual data to do this. Our research suggested that the more personal we got, or the more personalized we got, the more likely people were to read this, to remember it, and to take action on it. And this is what I mentioned before, personalization helps people feel understood. These are not health examples, Netflix, Spotify, and then Amazon, but all three of them are services that people engage with, not just because of the entertainment value or the convenience factor, but because you do develop a relationship with them over time. And then personalization can also make people feel connected by showing them how their contributions add up to something bigger. So Map My Run is an exercise tracking program. And at the end of the year, it tells you how much all of their users ran. So it will say all of our users ran around the world 7,000 times. You're part of that bigger picture. And then over here is the Darwin Challenge, which encourages people to eat less meat. So have a few plant-based meals each week. And that doesn't feel like a very big contribution to the environment on an individual level. So what it shows you is what the community is doing so that you can feel like you're part of a bigger initiative. So just in summary, to hack motivation, remember that you want to find opportunities to support people's basic psychological needs of autonomy, competence, and relatedness. And you can do that by helping people feel they have control, giving them meaningful choices, making hard tasks easier, encouraging progress through feedback, conveying a sense of growth and accomplishment, connecting them to someone else, and sharing how others are part of the same experience. So thank you.
Thank you, Amy. It's very, very interesting, your job. I really learned a lot with your book and your presentation. Just a first question. We know that there is sometimes people fail. So how to manage the failure in a process of change behavior?
Yeah, so a few things. One is to normalize failure as a learning experience. And I would suggest framing the intervention very early on to tell people you may fail and that's okay because that's how you learn what works for you and what doesn't work for you. Or in the case of something like smoking or weight loss, we know from research that it's very normal for people to fail, but it does not mean that they will not eventually succeed. I also am really interested in finding ways to help people analyze their failures and extract the good data from it. So not just saying, oh, oops, you failed, try again, but giving them some structure to think about what didn't work so that when we try this again, we can adjust our approach. And I think it can be really valuable as well to share stories from people who have been successful but failed along the way. So, stories about someone who has achieved that goal, but have them talk about what was difficult and how they made it through, because that is very relatable to people. We have an emotional connection to stories, and I think it's very hopeful when you hear from somebody who has failed but then ultimately succeeded.
Yes, it's very important to manage the learn. You know, it's very different in the culture of France and in American. In France, the failure is a bad word, huh? And in US, I think more Anglo-Saxon word is you manage better these things. The change behavior process starts by a decision. So if you don't decide to change, are you out of scope? And how can recruit this type of people?
So I use the metaphor of planting seeds. I find that it takes a lot of energy to design for people who are not ready to make a change that does not yield a lot of benefit. So I don't consider them in my user population when I'm designing. But what I try to do is to create a welcoming environment so that somebody who's not ready for change today can become aware of the intervention, sort of know about it, so that one day when the conditions of their life change and they start to think about maybe making a change, they recognize that there's a tool available for them. So basically, I prepare the situation for them to be ready for it. Um, but I do think a lot about people who are not yet ready to be part of an experience, or people who have chosen to leave an experience and maybe one day will come back. I think it's really important to create a welcoming environment around your intervention so that both of those groups would feel comfortable approaching you when they're ready.
So, but thank you a lot, Amy, to be with us today. Unfortunately, we can't be in France. I really hope that the next time you can be with us
Me too.
for the next event. And how about the time in US right now?
7 a.m. So early.
Well, they're very early, so thank you for to wake up so early for us. But have a good day, and
Thank
I
you.
hope if you have some, I can give the contact of you to the participant and
Yes.
of the event. So if they have some question about change behavior, I know that you can help them. So thanks for that. Thanks to be there, and hope to see you next time.
Yeah. Thank you so much.
Bye.